Good day everyone. Today we're going to teach you how to apply first aid, specifically severe bleeding. But first, what is bleeding? Bleeding is a loss of blood caused by external object or internally by our internal organs. Severe bleeding, if untreated immediately, will result into rapid blood loss, patient will become unconscious, and hemorrhagic shock. Also, bleeding may come from our nose and mouth, resulting to difficulty of breathing. Thus, make sure that there is no obstruction in their airways to avoid difficulty of breathing.
Step 1. Apply alcohol on your both hands, then wear gloves if you have them. This will protect you and the wound from infection. Step 2. The casualty may develop shock, so help them to lie down on a blanket or rug if there is one, to protect them from the cold. Step 3. Raise and support their legs so they are above the level of their heart. Do not raise the leg if it is injured. Step 4. Apply direct pressure on the wound with your fingers and use a sterile dressing or clean non-fluffy pad to stop the bleeding. If you do not have a dressing, ask the casualty to apply direct pressure themselves to stop the bleeding. Step 5. Ask a helper to call the emergency hotline number in your country for help. Or if you are on your own, use a mobile on speakerphone so you can keep treating the casualty. Tell the emergency services where the bleeding is coming from and the amount of bleeding. Step 6. Keep monitoring the casualty level of response while waiting for help to arrive. Step 1. Apply alcohol on your both hands, then wear gloves if you have them. This will protect you and the wound from infection. Step 2. If there is an object in the wound, don't pull it out because it may be acting as a plug to reduce the bleeding. Instead, apply pressure with sterile gauze pad or clean clothes on either side of it to reduce the bleeding. Step 3. Ask a helper to call the emergency hotline number in your country for help. Or if you're on your own, use a mobile on speakerphone so you can keep treating the casualty and tell the emergency services where the bleeding is coming from and the amount of bleeding. Step 4. Keep monitoring the casualty's level of response while waiting for help to arrive.
What are the types of wounds? The types of wounds are incised wound, laceration, abrasion, puncture, avulsion, and amputation. But don't worry, with steps, these things can be treated. Why do you need to elevate your legs when wounded? When we are wounded, the part where our wound located will have an increase in blood flow. It plays an important role in healing, and by raising our legs, ideally at or above heart level, will improve the blood flow throughout our body. What would happen if the severe wound is not treated immediately? If it is not treated immediately, it may result in shock, specifically a hypovolemic shock. It is a life-threatening condition that results when you lose more than 1/5 of your body's blood. It will make it impossible for the heart to pump a sufficient amount of blood, or worse, it could lead to death. Does alcohol really help in curing wounds? Actually, it is the opposite. The alcohol or the rubbing alcohol we have harms the tissue in our wound and would delay the healing of it. So, it is not advised to use alcohol on wounds. Remember, if you cannot control the bleeding from a cut or scrape, seek for a medical attention.